Welcome, everybody, to our Heart to Heart virtual town hall meeting. I'm excited to be here. I'm Cheryl Jackson. Today is National Pancreatic Awareness Month, right? National Pancreatic Cancer Awareness Month, and in the month of November. And today is actually National Pancreatic Awareness Day. And so today we want to bring awareness to this dreadful disease because it is a sneak attack disease in which we don't really see the symptoms until we know that we have cancer. And so I want to talk to some medical experts. I want to talk to some persons who have had pancreatic cancers and some family members who may have had family members who have also had pancreatic cancer, just to bring awareness so that you will know as our audience what this disease is all about, what this particular cancer is about. And the interesting thing is that in the African American community, we're always the community that's hit the worst when it comes to these health disparities, because a number of people in our community don't have insurance. A number of our people in our community don't go to the doctor, don't get checked up. So they always wait till the last minute. And so it really hits our community really, really hard. Today, we want to help curb some of that number. Today, we want to help inform some of our viewers and some of our listeners today to continually get checked up in some ways that you can make sure that you're not diagnosed with pancreatic cancer. So we want to jump right in. Thank you so much for joining us tonight. Share, share, share. Tell everybody. Like and share. Tell everybody on your page about this conversation. It is one that I think that we need to share across our platforms. So if you're on YouTube, share it. If you're on Facebook, share it. Join us tonight for this Heart to Heart virtual town hall. All right, let's go ahead and get into it. I have special guest with us tonight, Stephanie Taylor. And I'm real excited to talk with Stephanie. Stephanie is a pancreatic cancer survivor and advocate. Welcome, Stephanie.
Hi, how are you?
I'm well, thank you. I'm well. You are a breath of fresh air. So, we know that this disease doesn't have to be a death sentence because you're here to advocate against it. And that is so absolutely amazing. We also have as special guest Craig Irvin. He's the PanCan volunteer and fundraiser fueled by the loss of his sister to pancreatic cancer. And I just got a lot of great information from PanCan. PanCan is Pancreatic Cancer Action Network, and Irving is here to represent them. How are you, Irving? Welcome.
I am doing great, Cheryl. Thanks for having me on here. I'm so excited to be here to advocate.
And this is a great day to talk about pancreatic cancer since it's Pancreatic Cancer Awareness Day, right? And so now we can really talk about the facts about it and even what PanCan does. But before we do that, I want to talk with Stephanie. I want to go back to Stephanie and talk about her journey. Talk about your journey, because for somebody who's had it, I want to make sure that we give a full understanding of it. Before we go forward, my final guest is here. I'm excited. Excuse me for interrupting, Stephanie. Let me go and bring on our guest. Our medical expert, Dr. Marcus Smith Noel, is a board certified internal medical and medical oncologist with a clinical and research focus in gastrointestinal cancer. Now, in 2019, he was recruited to Georgetown University to serve as the medical director of the Clinical Research Management Office, part of the Lombardi Comprehensive Cancer Center. I love Georgetown University Hospital. Can I tell you that? Let me just throw that in as a sidebar. He has continued to design and lead trials in gastrointestinal cancer with a primary goal of increasing survival in this devastating disease. And one of the things I love, Dr. Noel, is that you're advocating for our community to make sure that this information is getting out to those people of color who may have been diagnosed in large number for this particular disease. So thank you so much for joining us today. It's exciting to have you.
Thanks for having me. Glad to be here.
All right. So I want to jump back to Stephanie because Stephanie is our survivor. I want to hear about her journey and what led you to become an advocate.
Okay. So let me just start off by saying that my story is not a typical story. My heart goes out to all those that have passed away and all those that are currently suffering from pancreatic cancer, as well as the caregivers. I know that this is a serious, difficult journey that they're on. So I feel very blessed to be able to be here to talk to you about my story. So my story, I had just had a physical, and I was doing all, I was working out. I actually had just started doing martial arts, believe it or not, at my age. And I was, doing martial arts. Everything was fine. I had a physical, but earlier I had a little bit of symptoms, gastrointestinal symptoms, but nothing major. However, my friends, they all know me. I go to the doctor in a heartbeat for something. And so when I had my physical, I went back to go over my physical results with my PCP, and I just happened to tell him. I said, I don't know if I could say his name, but I'll say Dr. B. I had felt this like little pain in my belly that kind of radiated to my back, but it wasn't anything major. And I would say that most people probably would not have even told their doctor that. But me being the way I am, I shared that with him. And, he just said, okay, well, because my physical lab results, everything had come back, everything was totally unremarkable, fine. And so he said, well, let's just have them do a sonogram of your kidney to make sure nothing's going on with your kidney. So I said, okay, fine. So they did the sonogram of my kidney, and he saw, the radiologist saw what they saw a spot on what they thought was my spleen. So then he's like, okay, we need to do further testing. We need to do a CT scan. So they did the CT, the scan, and it came back. They're like, no, we think we're looking at something on your pancreas. And from there, I ended up having an MRI. I ended up having an upper endoscopy, followed by a PET scan. All that was confirmed. It came out that it was pancreatic cancer. My surgical oncologist that has been following me the whole time, he was actually very, very surprised because I did not present with a lot of the clinical symptoms that most people have. And it ended up that I had what is called a neuroendocrine tumor, which is different than the adenocarcinoma, which Dr. Noel can talk about later. But my survival rate with the type of tumor I had is much greater survival rate than traditional pancreatic cancer. And then the other thing, it ended up being that where my tumor was located, it was located on the tail of the pancreas, which if you're going to have pancreatic cancer, I think that's probably a better area because it doesn't share as many vessels with the body and the head. And so I ended up having my surgery. This all happened in March in 2018. I had my surgery to remove the tumor. They ended up removing my spleen as well because of where it was in location to the spleen. And for, God's grace, God's grace, we're going to stay with that. But at the same time, I had an uneventful hospital course. I was in the hospital for a week, but I got very sick when I came home and I had to go back to the hospital. I had ended up having what's called a portal vein thrombosis. I had major complications. I was in the hospital for 2 months and had multiple surgeries after that. But fast forward to now, God's grace, I am good. I did not have to go through radiation, no chemo, no medication. I still don't take medication. Didn't take it before, don't take it now. And so, like I said, my course is very different, but I still like to share my story because it gives hope to people.
Yes.
And, I just want people to really be their own advocate for themselves. Go to the doctor. If you have any questions, share it and share it early. I'm all about early detection. Matter of fact, when I did the Purple Stride race in 2019, my team was called Early Detection because it was because of early detection for me. I am where I am today. So that's pretty much my course.
I hear it. And so I hear the urgency of making sure we're getting our regular checkups, making sure that we find out or we hear what's going on in our bodies so that we can share that with our doctors. And so I want to talk also with Craig Irvin, because I know you are a caregiver. I know what it's like to be a caregiver. And I know that you lost your sister to pancreatic cancer. Tell us your story.
Yeah, again, Cheryl, thanks for having me on. And, I always like to preference by saying my story is the story of many, especially in our community. And I'll take you a little bit back before my sister's diagnosis. In 2008, I coincidentally stumbled upon an episode of, and you may be familiar with Randy Pausch, who gave the last lecture, which was about pancreatic cancer. And for some odd reason, this story out of my head. I found the video and I was just obsessed with his entire journey. Didn't know why, but I was just obsessed with Randy Pausch's journey. And fast forward to 2013, early in 2013, my sister had been having these different pains. She started with pain in her stomach, pain in her back. She was just having consistent pains. And she had gone to a number of doctors who had given her several different diagnoses. In the final diagnosis ended up being fibromyalgia. And so we were pretty much content with that. She was taking pain medication. And at some point down through the years, the pain started getting really more and more intense until about December of 2012, going into 2013. It had gotten to the point where when she would eat food, the food would go down and it would be extremely painful. And she would say whenever she would get relief, when she would bend over, she would start feeling relief. She was having the back pains. And what is so not normal for me, usually I'm a person that would get on the internet, Google the symptoms. But for some reason, I really didn't think it was anything just that symptom. As a matter of fact, the doctor started associating it with indigestion. But when it got into the point where she was losing massive amount of weight, and when I'm talking about massive amount, I'm talking about probably about 10 or 15, almost 20 pounds in 1 month. She was literally not eating anything. And her oldest daughter is a nurse in Memphis. And so we decided to convince her to go to, let's go back. Her daughter talked with another physician in the hospital, and she was telling them all the symptoms. And it seems like my sister wasn't getting any relief. And he told her right away, he said, get her in here. That sounds like pancreatic cancer. And and she called me and told me that they were headed to the hospital. Went in, did the PET scan, and came back right away, said that she had pancreatic cancer. And I can still remember the day was on January 26, 2013. I can still remember getting that call. And it was like someone had punched me in the gut. And for me, it was like that because keep in mind, I kind of had a little knowledge about pancreatic cancer. I knew the severity of it, and I knew the fight that we were going to be in for. And so once she got the diagnosis in the hospital, I really didn't know what to do and where to go. You get this kind of diagnosis, what the stats are on it. I literally went on the internet and Googled, my sister had pancreatic cancer. What do I do? And the first thing that came.
Oh, we lost your audio.
Pancreatic.org and said, hey, my sister just got diagnosed. I don't know what to do, where to go. And so that's when I started getting the information. But I started off the conversation by saying my story is the story of many. It's because so oftentimes we hear about different elements, different diseases. You hear them, but in your mind, you always think, doesn't it affect me? It's not going to be my story. It's something for somebody else. And so the one thing I always say I regret as I'm advocating, I'm talking out here is that I didn't take the time to listen and know the signs and dig a little deeper, because when my sister first started having the signs, when she first started having the symptoms, in my heart, I believe that we could have been a little ahead of the game, which is why now I always try to really take time and learn the symptoms and know your body. And when you're having pain and when something is going on in your body is speaking to you. And so my sister started her journey in battling pancreatic cancer on January 26th. And she fought it for 4 months, a little over 4 months, and she ended up losing her battle on June the 7th. She did really good with treatment in the beginning, and as the months go by, it was obvious the treatment was not working, and the cancer spread it into the lungs. And once that, it was a very short battle.
Wow. And so now you advocate for her, and you're part of the Pancreatic Cancer Action Network. And by it being National Cancer Awareness Day, PanCan is doing a lot of great stuff in the community to help bring awareness and to create research. Is that correct?
Yes, that's correct. You know, one of the things that as my sister was battling cancer, as I said, she started in January. By going to pancan.org, I found out about these amazing events that Stephanie mentioned, Purple Stride. And so I showed my sister this. I said, hey, this is an organization. They have these walks and let's participate. So we were all geared up to participate in our first Purple Stride in Washington, D.C. And unfortunately, she lost her battle a week before the walk. And we actually memorialized her on the day of the walk. But one of the things that because when you're going through this, and I know Stephanie can speak to this as well as Dr. Noel, you know, one of the things you're going through this, the battle is so quick and so harsh. When it's over, you just want to forget it all happened. But about a month before my sister, we realized that she wasn't going to beat it. One of the things that she was looking at the pictures of Purple Stride, she told me, I want you to promise me that if I don't beat this, that you'll stay involved and you'll stay involved. And I felt like during the whole time, the worst part of that was that you feel helpless. I felt like I couldn't do anything. So the one time that I felt like I had control is through advocacy. I started right away to get involved with PanCan. I tried to work for American Airlines. I tried to get my company involved. I started a team, and part of my keeping her alive, because the hardest part of my sister's death for me was thinking that she got this horrible disease. It was devastating. It was quick, and people would just forget about her the next week. And so part of my fight was making sure that her death wasn't in vain and making sure I keep her alive. The way that I keep her alive is by advocating and making sure that as few families as possible can have the story that I have. It's not on other signs. I didn't know what they meant until it was too late. So PanCan has given me that great opportunity, and I always say I have an amazing purple family. Everywhere I go, I talk purple, and if my advocacy can save just one person, then my sister continues to live.
Absolutely. Absolutely. I love that. And of course, for those that are viewing, you can see that you can find out more information at pancan.org. The website is right there on our banner. I'm real excited to have as well our medical professional today, Dr. Marcus Smith Noel, and he's going to tell us a little bit about, I want to know specifically what pancreatic cancer is. Like, how do we, and give us some insight as to why it's so hard to detect. Like, why is it this silent killer?
So that's a great question. So pancreatic cancer, the pancreas is an organ that sits in the abdomen, but is kind of tucked back behind the stomach. The purpose of the pancreas has multiple roles, including regulating blood sugar, helping with food digestion, and essentially, cancer in general is an abnormal cell growth. And so any condition that causes inflammation of the pancreas, whether it be diabetes or other chronic pancreatitis, you can be at risk for developing pancreatic cancer. The problem with pancreatic cancer is a couple of issues. Number one, based on where the organ is in the body, it is in a location that it's really hard to detect. So, for example, breast cancer, the breast is external. If there's an abnormality there, you can visualize it or palpate it. If you have colon cancer, you may see blood in your stool, etc. But with pancreatic cancer, the organ is in a place where it's almost hiding between other places. So it's really hard to detect anything abnormal in that area.
Wow.
The second problem is that this is a very aggressive cancer, meaning that once it starts to grow, it spreads very quickly. And so oftentimes you develop a mass in your pancreas, and it could be, let's say, the size of a grape or even smaller, and you may not have any symptoms because it's kind of tucked back in that area there. And then when it begins to grow, you may develop some symptoms, but it's already spreading by that point. So by the time it's a few months, by the time you come in, you've lost some weight, you meet with your physician, and it's already been 2 or 3 months. And even in that short interval, the cancer can already have spread. So believe it or not, with the most type of pancreatic cancer, which is adenocarcinoma, 85% of patients, when they're diagnosed, are already stage 4, meaning the cancer has already spread to other places in the body. And that's devastating because once the cancer has spread, we don't have a reliable means of treating or curing the cancer. So the cancer is already, widespread, whether it be the liver or the lungs in someone's body, and we can only utilize chemotherapy to try to treat it. And so, unfortunately, many patients, by the time they're diagnosed, they're already at a place where the options are quite limited.
Wow. So, and you're working in this department and working to save lives. What are some of the things that you do when you first realize it? Or, I'm sure you know some who may have survived it or may even be living with it now. What has been some success stories? Like how were you able to create some success stories from behind this?
So, most importantly is being able to detect it at an early point. So as Steffi mentioned, being able to, if a patient has symptoms and something's not quite right, definitely want to speak up to your physician, because if it can be caught early, those are when we have the best chance for success. So my patients who have done well, it's when it's been caught early, where they come in, have a scan, and then have detect cancer, and then have surgery to remove it at an early time point. So, by and large, that's definitely the most important thing, is to have early detection, to make sure that we catch it early. My role as a medical oncologist, so in my role, I give chemotherapy. So the majority of my patients already have advanced cancer, and so it's a challenge to try to treat them. But I am a big proponent for early detection and speaking with, educating the community, primary care physicians, to bring awareness to this disease. Because even, back in 2012-13, which is only like 7 years ago, we have so many more treatments now than we did back then. And so it should not be thought of as a death sentence. And so I try to bring that awareness so people can understand that, we need to find this cancer early, because we have options for treatment. And even if it's caught a little bit later, we still have better options now than we did 7 years ago. So that's another thing that I do. And then research. So I'm involved with clinical trials, which are evaluating new options, new drug options for patients that may perhaps help them to live longer with this devastating disease.
Wonderful. That's the breath of fresh air we want to hear, right? We want to hear that there is some progress. And I know PanCan is one of those organizations that's helping, advocating for research. I want to open up to our viewers as well, for those who may have questions on our YouTube and our Facebook page, those that are watching on our website at praisedc.com. If you have questions for any one of our panelists, I want to be able to address those. Gloria Perry says, thank you for hosting this event and raising the awareness. It is our pleasure. It is my pleasure to share this information. So I want to talk with Stephanie, if there's anything that you would want to say to our viewers, because you actually went through the physical of all of this. I know we've talked about early detection. I know we've talked about getting in there, but if you were to talk to our audience, which is everybody across the board, because we're international now, what is a major message you'd like to send to our listeners?
Okay, so first I would start off by saying take care of yourself now.
Mm-hmm.
Try to be in the best health stance that you can be in now, because if you do have something that happens down the road, it's going to help you fight, and you're going to already, your baseline, you're going to be stronger. So that's the first thing. The second thing I would definitely say, stay on top of your preventive medicine, your daily, not daily, but your annual physicals, things like that. Listen to your body. My friends who may be watching, they know me. I have a nickname. They call me Typeweight Mary sometimes, because they're like, Stephanie has a headache. Oh my gosh, she needs to have a CAT scan. But that's okay, because that is actually what saved me. Like, I am very much advocate for health and early detection. So, just listen to your body. If something doesn't feel right, and excuse me, but we're talking gastrointestinal stuff, but if it doesn't look right, I mean, look at your stool. Does it look different? Does the color look different? Is it a different texture or whatever? Those are some of the things that you need to look out for. Like Dr. Noel said, unfortunately, there are a lot of the thing about pancreatic cancers that there are a lot of times there are no symptoms until the very end, and it's very aggressive. So, I'm just very thankful that I have a great doctor that took it upon himself to just say, okay, let's just do a sonogram of your kidney. Honestly, I don't think a lot of physicians may not have gone that route. And if he had not said that, I probably wouldn't have even advocated for it for myself, because I wasn't really feeling bad. So that's another thing. It's very, very important to have a good relationship with your PCP. You need to know your doctor. Your doctor needs to get to know you. And then the other thing is be an advocate for yourself. Mm-hmm. Or have someone that can help advocate for you, but definitely listen to your body, stay in the best health and shape you can now in the event something does happen, and have a good relationship with your PCP.
Got it. So Iris Holmes is asking, what are some of the symptoms you should look for? And I know it's called a silent killer because it's really hard to detect based on these symptoms, right? So Dr. Noel, tell us some symptoms that you can look for.
Sure. So because the pancreas is involved with digestion, one complaint that we often hear is after meals, patients may experience abdominal pain or bloating, or even maybe not be able to complete their meal. This will happen like on a daily basis or multiple times per week. So if that's going on for several weeks, that should be an alarm. The classic symptom of, as I've mentioned, is pain. The pancreas is located closer to the back. So pain in the abdomen, it starts in the belly but goes towards the back, is a classic symptom for pancreatic cancer. Mm-hmm. In addition, unexplained weight loss. So you're not, you didn't just start going to the gym or, starting a new diet, but you're all of a sudden losing weight. And it's not like, 5 pounds, 10 pounds. It's like 15, 20, 25 pounds. It's significant weight loss. That is an alarm for not only pancreatic cancer, but any kind of cancer in general. So any adult that's losing weight that's unexplained, it's definitely abnormal, and you should definitely seek out medical attention. Mm. Another symptom is, and oftentimes because the pancreas is near the bile ducts, it can cause a blockage, and it can cause you to turn jaundice. And that will cause the white part of your eyes to yellow. Your skin can become darker. It can be harder to detect in African Americans. I've had many African American patients who, or their physicians missed it because the skin color didn't change till a little bit later. But you can develop jaundice, which can not only change your eye color, but can cause very dark urine and light colored stool. So it's very important to monitor your stool, not only for blood, but also for its color, because if you have light colored stool, that could be a sign that there's a blockage in your bile ducts.
Got it. Mm-hmm. So those are some symptoms. And again, they can be pretty vague, but and you've watching your body and paying attention to your body, you might be able to detect early on what's going on. So I want to talk with Craig about PanCan, because I know that this has kind of been your life-saving mechanism, right? Like you said, helping and keeping your sister's legacy alive. But there's so much information you can find on PanCan. In me preparing for tonight's presentation, I literally went on and got as much facts as I could from the website. So talk a little bit about PanCan.
Yes, that's correct, Cheryl. PanCan, it was a lifesaver for me. As I stated, I had not heard of PanCan prior to my sister's diagnosis, and when I Googled it, it came right up. But the thing that I love about PanCan, it does give me and survivors and other people who have lost, or people who have no attachment to disease, it gives us the ability to advocate. It empowers us. And the hardest thing for me was about pancreatic cancer was dealing with that battle with my sister of losing the feeling of loss of control, feeling like I couldn't do anything. And through PanCan, it gave me my control back. And I always say, on my social media, I always say, take 5 and 5, 5 minutes to read the signs and symptoms and tell 5 people, because I think that's the key to it, is to continue to advocate. Amazing programs like Purple Stride. Purple Stride it raises funds for research, but not only does it raise funds for research, it gives you an opportunity to come together with people who have shared experiences. People like Stephanie, who beat pancreatic cancer. People who've lost loved ones like myself. It is an amazing family. Right now, I have 2 individuals who are fighting a really hard battle with pancreatic cancer. So it's important for me to remind myself why I fight. We have a saying with PanCan and with the different affiliate, knowing your why. And for me, my why was my sister at the time she was fighting. But now my why is all of those individuals that are out there that are still fighting. And I tell myself this on a daily basis. Every freedom that we enjoy now, be advocated, someone marched, someone fought that we can enjoy some of the freedoms that we have, especially when it comes to medical health. So that's what PanCan means for me. It is giving me the freedom. But on a personal level, at the end of the day, and I always tell all the individuals from PanCan, they're my purple angels, because they've given me the ability to keep my sister name alive. It's a very harsh, it's a lonely disease, because it's so aggressive and it moves so fast. You feel like you're completely out of control. But now I make myself available to others who are out there fighting, or others who are lost it. I mean, it's amazing. It's an amazing organization. A lot of my friends who are on social media, if I post something, they always come back and say, who are all these people with this purple that's coming on your page? And I always say it's my purple family. And I tell you, a big moment for me was, as I said, I work with American Airlines. A big moment was for me is to get my company engaged, to get my colleagues to see the importance of fighting. When my sister was diagnosed, the survival rate was 6%. Now we're at 10%. And it may sound like a small number.
No, yeah.
Huge. It's huge. And I remind myself of that all the time, is that maybe when I'm long gone, or many years from now, I truly believe we're going to find a cure. And to know that I was part of that, it is just unbelievable.
That's awesome. You do have a big support system, because I'm looking at some of our thread on Facebook, and they're like, talk, Craig. They're like, you in church. Speak, Craig. Say that, Craig.
Yeah, I love them all. Yeah.
So we do have a few questions. We're going to wrap up in just a few moments, but we do have a few questions from our audience. What race is most accessible to pancreatic cancer? And then how soon will the new treatment be available? And I know that that's ever evolving, that there are treatments coming, still in testing phases, and that treatments are coming. But how soon will the new treatment be available? And then, is the new treatment as harsh as radiation? Because I think that when we talk of cancers, that's the major thing that people think about. And I know you as an oncologist, Dr. Noel, that radiation and and chemotherapy is so hard. It's so harsh on the body. And a lot of people can't survive that, the treatment portion of it.
Mhm.
So those are some questions I want you to address quickly, and then we'll have you guys give final statements, and we could close out. But I think I want to address those questions first.
Sure. So we do see, unfortunately, that African Americans seem to be higher rates of pancreatic cancer, certainly higher rates of death from pancreatic cancer. We're not quite sure why, whether it's a connection to diabetes, perhaps diet. Is there a different biology of the tumor? Is it more aggressive? We're not quite sure, but certainly the death rates in Black patients are higher than our counterparts. In terms of new treatment, so so from a surgical standpoint, many surgeons now are able to operate laparoscopically, even for pancreatic cancer. So that would require less incisions or smaller incisions to remove the tumor, and so that results in a shorter hospital stay and quicker recovery. We have newer radiation techniques. At Georgetown, we have what's called a proton therapy, where it's a type of radiation, but it's more focused and less toxic. So that's being used for treatment of pancreatic cancer. With regards to chemotherapy, we still utilize chemotherapy for treatment, and you're right, Cheryl. The chemotherapy can be harsh, but we're trying to modify that chemotherapy or use better medications with the chemotherapy to lessen the side effects of it. There was a new pill that was approved for a small percentage of patients with a genetic mutation, a genetic defect causing a pancreatic cancer. This was approved by the FDA a few months ago, and this is a pill that can be taken, and the side effects of this are less so than chemotherapy. So that's some good news there. And then there are ongoing clinical trials looking at new treatments that are not yet FDA approved, but hopefully in the next 1 to 2 years, we will see some more approvals of pancreatic cancer.
I love that. My dog is intruding, right? So I love that information. I pray that our listeners have gotten that. Now, also, we have a question about donation to PanCAN. How people can give in donation, as PanCAN has been an advocate for pancreatic cancer.
You can go to pancan.org, and no amount is too small. It goes back to what I was saying. That's a way that any and everybody can get involved. And a lot of time we think that, I got to be able to give hundreds and thousands of dollars. Yes, we'll take that. But even $5 can make a difference. So go to pancan.org.
Awesome. Thank you so very much. Listen, I really, really appreciate everybody joining us today. I want to give our guests final, words to those who are viewing tonight before we close out. But this has been a wealth of information. I really appreciate your time. And for those who are viewing, I want to say it's, National Pancreatic Cancer Awareness Month. Today is National Pancreatic Awareness Day. So make sure you find out more about it so that you can detect things early, and that you can share this information with others and get involved. All right, so I'll give you guys opportunity to give final words.
Okay, do you want me to start?
Yes, that's fine.
Okay. So again, first of all, thank you very much for affording me this opportunity to share my story. I can't stress enough about getting a good PCP. Having that relationship with your PCP, know your body, listen to your body. No question for a doctor is too small. If there's something that doesn't seem right, then just ask the question. Just take care of yourself, stay on top of your health. And I am a story of hope, and I want people out there to know that it doesn't have to always end the other way, that you hear of it ending so many times. But PanCAN is an amazing organization. to be involved with. The grassroots effort that they do, the fundraising they do, it's near and dear to my heart. So check it out. Like Craig said, pancan.org. There's a wealth of information on there for people. And so stay hopeful and be blessed.
Awesome. All right, Craig, you could give your final words as well.
Sure. First of all, Cheryl, thank you so very much for having me on. What a gift it is for everyone who's still fighting for you to host this event. The next thing I want to give two individuals that I spoke of earlier who's in a tough fight right now with the disease, Adam Deal and Sang Watts. I love you both. We're fighting with you. And then next, I want to tell any and everybody who ever hears this show to get involved. I don't care how small it is. Go to pancan.org, get involved. You can do so much to help change the story about this disease. Know the signs, and I'll leave you with what I stated earlier, 5 and 5. Take 5 minutes to know the signs and tell just 5 people. It can be life-saving and changing. And again, thanks, Cheryl.
You're very welcome. All right, Dr. Noel.
Thank you for having me. This was a great discussion. Stephanie and Craig, thank you for sharing your stories and for continuing to advocate for those who are unfortunately afflicted with this disease. To our listeners, I just want you to again be aware of the signs and symptoms of pancreatic cancer. For your loved ones, if you have a friend, a colleague who may not be feeling well, encourage them to speak up, to reach out to their physicians. And if anyone unfortunately or know somebody with pancreatic cancer, to just give them hope, to know that that we're working as hard as we can to research new options, to not give up, continue to reach out, and we pray that you can live as long as you can, hopefully beat this disease.
Wonderful. Thank you so very much. I love this, guys. And, I love that this group of people that are viewing and watching are praying people. So we can certainly pray for those who have been diagnosed with pancreatic cancer and pray that, early detection will save some lives today. Just the information that we've shared today, I believe that is going to save some lives today. I know for a fact, I'm going to ask specifically when I go into my primary care to test and to make sure that, all blood work is done or whatever, be proactive like Stephanie and make sure that I know what's going on with my body on a yearly basis. And I think that will help a whole bunch. So thank you all so much. Thank you to our viewers on Facebook, on YouTube, on praisedc.com. Thank you for being a part of this conversation with us tonight. Thank you for sharing it on your platforms because this gets the word out even the more. And thank you to Praise 104.1 and to our management and staff, Karen Jackson. Thank you so much for these heart-to-heart town hall meetings that we're having on this platform to get this kind of information out to people everywhere. So we appreciate you guys tonight. Thank you so much for joining us. That's going to end it for our heart-to-heart town hall meeting tonight on Praise 104.1.
Thank you.